Can you guys introduce mommy?
Spill the beans with Dr. Jill.
Hi, everyone. Thank you for joining on today's episode of Spill the Beans with Dr. Jill. As always, I would like my guests to introduce themselves.
Hello, thank you so much for having me. I'm Ray Nardella, he, him pronouns. I work at the University of Maryland in College Park, Maryland, overseeing student conduct for our residential population of about 13,000 folks, as well as a deputy Title IX coordinator. Been here about 10 years. Um, my training is in counseling and law, so kind of adjacent to what I do. Um, yeah, I'm from Connecticut originally, and now I'm a Marylander.
Very nice. Ray, do you consider yourself in the helping profession?
Yes, absolutely.
And now with your credentials, do you consider yourself some of the medical profession?
Yeah, yeah, absolutely. Mental health and medical, I think, are interchangeable at this point. Yeah,
Yeah.
yeah.
And tell me, with all the schooling that you've gone through, has anyone ever taught you about vicarious trauma?
No, to be honest, it's interesting. In my graduate program, I did take a course in crisis and trauma counseling. So yeah, guess I shouldn't say no unequivocally. I think we sort of touched on some aspects of vicarious trauma, but truly understanding the substance, I don't think it was there. Yeah.
And is it fair to say that there was conversations about maybe self-care?
In schooling,
Yeah.
yeah, yeah, I think to a degree. I think, especially in the clinical counseling sense, I think, we learned how to do critical self-reflection. We learned how to um, set boundaries professionally and clinically. So there was a good deal of that, which I appreciate.
Yeah. So are you the same practitioner today as you were when you first started?
Not at all. No, no. I really fortunate to have had the opportunity to go to school for a long time. I always joke, I'm like, I didn't have friends for 35 years, but I you know, being able to understand student affairs work, particularly student conduct work, from the lens of um, layering, right, and understanding what goes on beneath the behavior and the root causes of things is invaluable. So I credit the counseling education for that.
Mhm.
Yeah.
Can you share with us what you researched for your doctorate?
Yeah, absolutely. So I looked into um, specifically veterans in outpatient psychiatric facilities, and I looked into the cost containment involved in that. So particularly, I looked at, in essence, what it was do insurance companies um, pay what they need to
Yeah.
for our veterans, particularly in outpatient crisis psychiatric facilities. Um, and mixed results there, right? There are some really good things that come from particularly federal insurance when it comes to reimbursements and comes to mental health care, particularly acute mental health care. But
Mhm.
there's also a lot of gaps, right? So
Yeah.
so that's what I looked at in my doctoral
When
research.
you did your research, did you speak with veterans?
Yeah, quite a few veterans.
And were you able to kind of protect yourself in that process, or what did you walk away with that as far as your vicarious trauma? Because I'm
Yeah,
making some assumptions from my lived experience. I'm assuming that people, when they feel comfortable with like a counselor or a researcher, they will share.
yeah, yeah, absolutely. I appreciate that question, and the vicarious trauma aspect was a lot. And I identify as neurodivergent. I have Tourette syndrome, so you'll see me ticking and twitching. And a lot of what I spoke to veterans and even some active military folks about was were injuries, right, and illnesses that they sustained in active duty that were neurological based in a lot of cases. So there was certainly a connection there. to my personal lived experience, and walked away from some of those interviews feeling that the weight of that.
Right. And that's what a lot of what we talk about on the podcast and in the workshops is how do you not just set boundaries, but how do you process the evolution, the reflection, all of that that you're going through after you hear somebody else's story of trauma.
Yeah.
Especially, I mean, you're sharing so much about who you are and your identity. I would also assume that that opens more narratives and that even your students and other patients and other clients are more willing to share when you're transparent with what you're bringing to the table.
Oh, 100%. One of the things I took away from all the counseling training was the therapeutic alliance, right? And the relationship is 80% of whether or not treatment is going to be effective. The modalities are important, and of course, the techniques and the clinical interventions are scientifically important, and 80% of it, at least 80% of it, is the connection. So when I'm able to disclose, hey, I have Tourette's, I do identify as neurodivergent, I have OCD, etc., that will really, really help a client and facilitate growth with them.
Wow. Thank you for sharing, Ray. We really appreciate it. So, what tools or strategies have you learned have helped you in this process?
I think really firm boundary setting is important. I'm one to sort of not practice what I preach, but I think the journey is teaching me that setting boundaries is critical, whether it's at work, whether it's socially, whether it's clinically.
Mhm.
That's going to be invaluable to who you are as a person, who you are as a professional,
Mhm.
and everything in between.
Is it fair to say that setting boundaries could also include not taking on too many cases in one day, making sure that you get lunch, making sure that you prioritize the kinds of cases you're taking on?
Absolutely. Absolutely. And I think honestly I really appreciate that framing of it, because I think that's oftentimes nuances of boundary setting that might go unnoticed or unrealized. I think oftentimes when we talk about boundary setting, it might be, making sure you leave at the end of the workday, or making sure that you carve out some time for a walk or a stretch, which is fantastic. And some of those substantive things are really important,
Mhm.
right? Maybe I don't take on five heavy cases in one day. Maybe I spread it out over a few days, or maybe lunch, right? Lunch is critical. It's a meal. So making sure I eat and take care of myself is important.
Right. Do you find that maybe if you don't nurture your self-care and your vicarious trauma, is it possible that that can flare up some other distress for you?
Yes. Yes, particularly around my tics, my motor tics and my vocal tics. You know, being exposed to trauma, vicarious or sort of direct, um, sets my nervous system into dysregulation, and my tics are all over the place, and that then sets off panic and my other OCD symptoms. So it's kind of a vicious cycle. But I do, in 36 years of life, one of the things I realized is that taking intentional time to set aside and making sure I take care of myself and my environmental factors as well will help with that.
Right. So I love that. I almost want to create like a campaign. Back in the days when we were younger, there was this milk campaign, and it was drink a glass of milk, it does your body good, you know? And they had shirts, and, it was a whole thing. And I would love for us to say, treat your vicarious trauma, nurture your vicarious trauma, it does your body good. And I think that you're living proof of saying, yeah, if we don't, we actually physically can have these other ailments, and you're sharing so much of that.
Absolutely. And it's so interesting because oftentimes, we're in what, 2026. I have to look at the year. We have pharmacological interventions for everything,
Right.
right? Which is great in some cases. And those those substantive opportunities to, like you said, nurture vicarious trauma
Hmm.
and reflect and truly understand roots and where it comes from, um, is a non-medicinal way to do that, right? So it's so important to be able to to lean into that.
Right. One of the kind of tricks and tools that I give during my workshops is I think it's great when the medical profession in particular says that when you're upset at work, you should go for a walk. And I think fresh air and resetting is really important. But what I like to teach practitioners is rituals within their office space before they go and get the fresh air because they're always going to have to go back to the office. And we don't want the office to be associated with trauma. And so I teach them to create rituals, whether that's like washing your hands or listening to music or doing something to reclaim your space. Is there any tip that you do that you have found yourself doing that has helped you when you go from client to client or student to student? Is there anything that you have learned that has helped?
One of the things I've learned in my journey with Tourette's and my tics is this idea of somatic body sort of processes. So, what I mean by that is like sometimes I'll feel my pulse, right, just on my palm right here, and that'll help ground me a little bit.
Yeah, I love
That'll
that.
help. Yeah, it's really and it also helps reduce tics, honestly,
Right.
which I've noticed the past few months. So after a really tough student meeting or a parent meeting or attorney, insert person here,
Yeah.
I'll just relax, breathe a few times, feel my pulse, and
Hmm.
that sort of allows me to ground myself in senses and sensory experiences. And I have a little stress ball on my desk that I sometimes just play around with, and
Hmm.
it really does help.
That's a great tip. Well, we thank you so much for all of your information today. And I always have the guest leave with a mantra, maybe a famous quote, some words of wisdom to spill the beans. Do you have anything for us today?
I always tell folks I'm living the dream, and sometimes they think it's like sarcastic, like, okay, you're living the dream, but I really am. Life is tough, and we're tougher. So I'm living the dream, and I think you should too.
Thank you so much for joining us on today's episode. We hope that this information is helpful to you and reminding you that you're tougher than anything that comes your way. Thank you so much. Thank you for watching on today's episode, and I hope that it was so helpful meeting this professional who has dedicated a majority of his career to learning the law and counseling and being able to support others. The transparency that he has with the audience and everyone that he comes across is humbling, something that I strive my reputation. I really want people to also be able to say that about me. And I really appreciate that about this professional. Couple of things to reflect on as he was talking. The research that he has done with the veterans population, his experience counseling a array of students, faculty, staff, individuals. I think that it all goes to show you that he has different points where he can be absorbing vicarious trauma, but he's also very aware of what he needs personally to be successful. His physical body will show him, and he grounds himself with listening to his pulse. So I love that strategy. There are a lot of other techniques for sensory care, one in which I teach during my workshops as well. And I do think that it's important that we do tap into our natural surroundings and ground ourselves when our mind and our body are bringing us other spaces. It's our job to hone in and ground ourselves. So. I also love that it left us with the inspirational quote of, life is good and there's going to be tough times, tough challenges, and you need to remain and have that grit that you have learned how to take care of yourself. We just need to listen to it. So, some solid words of wisdom, great reflection and time that I got to speak with a practitioner that I admire, someone that I know is doing great work and is reminding us that in order for him to do that great work, he needs to take care of himself. So, hope you do the same and have a great day. Bye bye.